So we are in western Wisconsin, a little town called Arcadia. And Arcadia is about 15 miles from the Mississippi River, about halfway through the state of Wisconsin from north to south. I was born and raised on the farm that is next door here. My folks bought the farm in 1946. Our first use of the Farmatan product on our particular herd was with our beef cattle. We had a situation where every year we would have beef calves that would develop scours about a month after they were born. And it didn't matter if we had them on the pastures that were on our farm here or if we had rented pastures and moved them out. We had tried a number of different ways in terms of vaccinating to prevent the disease. We had narrowed it down at one point to being cryptosporidiosis, and that was done by the diagnostic lab in Wisconsin. And one of the considerations that Paul Mitchell had said was that you can have some reduction in cryptosporidium incidence by the use of the Farmatan. So the program that they recommend is to use Farmatan prior to calving, 3 months prior to calving, and then continue it on through to 2 months after calving. So we started with that program and we saw immediate results. The first year it was greatly reduced. Now it is not an issue for us anymore. So that was the first place where we would have used Farmatan on our farm. As time has gone on, we've used other products of theirs on our farm. We do use the Farmatan in a similar way for our ewes and for our does prior to kidding and lambing, and have seen a reduction in the scours incidence. It's the overall improvement in the health of the animals, we feel. After we were comfortable with using the products on the farm, started to recommend that the Farmatan products to clients on our veterinary route. It started out with, again, using it on beef calves, beef cows and calves. A couple of years ago, we had very high incidence of calf scours in herds in our area. Had also heard of that in herds in around the Midwest and in the West that I consult with. So we started recommending the use of the Farmatan in those herds also, and had good success. The way that I would deem or would consider something to be successful is that people want to stay on a program. Number one, that they see results. Number two, that they want to stay on the program. So when farmers and ranchers are willing to do that, that is kind of the testimony that you have a product that's going to work well.